is the news at 10.
Welcome back. That new COVID variant we told you about minutes ago is causing issues for travelers in South Africa.
Many say they are stranded since several countries have imposed travel bans on that country after the Omicron COVID variant was discovered there. President Biden says the United States will ban entry to most travelers from South Africa and 7 other countries in the region starting tomorrow.
And as crisis standards of care in most of the states has been lifted, in most of our state has been lifted, health officials in Idaho continue to say now is not the time to relax on safety measures when it comes to the pandemic.
The new variant has health officials concerned that this could be the next highly transmittable wave of cases. Tristan Lewis joins us tonight with what they know about the new variant and what they're still trying to figure out. Tristan.
So, Mark and Kim, the new variant Omicron was detected earlier this month in South Africa. Dr. David Pate says researchers don't believe it originated in South Africa. It was only identified there first because of their testing capabilities. Researchers believe it started in a country where vaccination rates are low, but don't know exactly where. So there is still a lot of what health leaders are still learning.
You know, unfortunately, what we know so far is not very much.
As more families and friends celebrated the Thanksgiving holiday this year than last, the reality of the pandemic is kicking in once again as news surrounding a new COVID variant starts making waves.
This may be what we've been warning about.
Idaho medical expert and former CEO of St. Luke's Health System, Dr. David Pate, says while there is not a lot known about the new Omicron variant, it still has researchers worried.
The more that transmission there is, the more mutations you get.
He's not sure the variant is of concern, but there are a few reasons it could be looking that way. One is the number of mutations it has in it. Pate says most of the other variants saw around 10 to 15 mutations. Omicron has more than 30.
Some of the mutations, we don't know what the significance are. Others of these mutations we know have been associated with increased transmissibility and increased immune evasion.
The other area of concern are breakthrough cases and people who tested positive for Delta that appear to have been infected with Omicron.
With all of that said, it is extraordinarily unlikely that this variant can completely escape the immunity that we've gotten from vaccines. At this point, we have no reason to believe that those people who are fully vaccinated, and probably especially those that have gotten fully boosted recently, we have no reason to believe they're not going to be protected.
Pate says while it looks like it has all of the ingredients to capture the world's attention, again, it is still too early to tell.
We'll see. You know, we have been concerned about some other variants before, and they didn't turn out to be very big threats for us in the United States.
And right now, there are no confirmed cases of Omicron in the U.S. I reached out to the Idaho Department of Health and Welfare to check out how they'll be monitoring the variant. In an email, they told me it would be reflected on their dashboard on their laboratory testing page, just like how they've been monitoring other variants. However, they don't test all cases. And they add the best way to avoid getting sick is by getting vaccinated and continuing to take the recommended precautions against COVID-19. Mark and Kim.
He made it very clear, I thought, that being immunized really is the best way to protect yourself against this variant and, frankly, all variants that have come down the pike over the last nearly 2 years now.
Yeah, making the case to get out and get vaccinated if you haven't already. All right, Tristan, thank you. And Dr. Anthony Fauci, along with the rest of the COVID-19 national response team, met with President Biden Sunday today at the White House. They briefed him on the latest developments of the Omicron variant.
Fauci says he believes existing COVID-19 vaccines will likely add a degree of protection against severe cases, but it's going to take 2 more weeks for him to get more information on how this variant is transmitted.
He added booster shots for fully vaccinated individuals will help and recommended all vaccinated adults to get their additional shots as soon as possible. The president plans to provide an update on the new variant tomorrow.
And as of tomorrow, the new variant hasn't been found, as Tristan mentioned, in the U.S., but COVID obviously is still here. The latest numbers that we have from yesterday show that the state has reported another 8 new deaths, along with 238 new probable and confirmed cases. And you can see on the graph, we have been trending downward, as you can see on the right side of the graph, for a few weeks now. That is very positive.
The same goes for hospitalizations. You can see we're continuing to decline when it comes to the number of Idahoans in the hospital with COVID. This follows Monday's announcement that the state deactivated crisis standards of care for most of the state.